now new legislation on the Pfizer COVID-19 vaccine, as supporters of the bill say that it would help inform people of the long-term risks of the vaccine.
But then opponents on the other side say it could also spread misinformation and discourage people from taking the vaccine. News 19's Josie Frost has been following this story from the beginning and now has all the details for your family from the State House.
Sponsors of the bill call it a warning label. It would be a disclaimer before you get the COVID vaccine that the long-term impacts of it are unknown. But experts disagree on whether this is true and whether that disclaimer might be misleading. Under the bill, providers would have to tell patients that the COVID-19 vaccine is a novel vaccine, that the long-term impacts are unknown, and that it contains fragments of bacterial plasmid, or DNA. Some against the vaccine argue that this DNA will get into the cell nucleus and could lead to cancer or other genetic damage. Kevin McKiernan is a genome researcher.
This is not a small quantity. This is a very large amount of DNA that is left behind inside these vaccines.
The U.S. Advisory Committee on Immunization Practices recommends a vaccine for all people 6 months and older based on their individual choice. Doctors like Elizabeth Mack say the DNA will not stay in your body and it has no long-term impacts.
And I thankfully have never cared for a child with a COVID vaccine complication in the ICU, but unfortunately have cared for hundreds of kids in the ICU with COVID and unfortunately pronounced too many dead.
With conflicting testimony, some lawmakers say they need to clarify whether the warning they're about to give is true or misleading.
But I don't want people to not do something thinking that this is 100% factual, and then they end up passing away because they refuse to take the vaccine, which could have helped them.
It doesn't try to remove the vaccine. It doesn't do any penalties. It's simply informing the public that the vaccine may be contaminated, and you should take it at your own risk.
The bill had previously been advanced to the full Medical Affairs Committee, but lawmakers sent it back to the subcommittee for more testimony. Now it's going back to the full Medical Affairs Committee, where lawmakers say they're hoping to hear more testimony from experts on its impacts before it can be advanced to the Senate floor. Reporting at the State House, Josie Frost, News 19 WLTX.